It's the kickoff to summertime travel season. With record-breaking travel expected, millions of people planning to take trains, planes, automobiles, cars, I guess. Yeah, this weekend, it's off to a start for the long summer travel season.
Okay, so we know there have already been some travel problems. I'm looking at you, Newark. You also don't want those woes to turn into physical aches and pains.
Yeah, that's why we've asked physical therapist Dr. Karena Wu from Active Care Physical Therapy to join us. First of all, thank you for being here.
Thanks for having me.
Okay, so first up, let's talk about those who are hopping on a flight right now. So the TSA lines may be long and, you know, suitcases may be heavy. What are your tips for navigating all of that?
People do not like to put down their bags, but when you have a heavy bag, stop carrying it on your shoulder. Yeah. You're shrugging your shoulder up, you're standing crooked, you're going to cause neck, shoulder, back pains. So put the bag down and use it as an exercise session. You're going to have good upright posture. You're going to squat down with good form, using your legs. Pick up the bag, walk 1, maybe 2 steps, place it back down because you want to get some muscles going and blood pumping before you're going to sit.
Okay, so don't laugh at me when you see me in the line using my suitcase doing RDLs. Like, you know.
Yes, you can, you can also slide it if you really are okay sliding the bag because you'll work the inner thighs.
Yes. And do you switch to the other side as well?
Yes,
yes. Do both sides.
Use the squats, but you're going to work both of the legs equally, so easy, one and done.
Okay, we love that. Okay, what about if you're sitting on a plane for hours? It can be uncomfortable. What do you do to kind of alleviate some of the neck and back pain? And also swelling can be an issue, right?
Yes, the deep vein thrombosis. So the number one thing I tell clients is when you're sitting for a long period of time, do not cross your legs because it torques your spine and it compresses soft tissues and your nerves and your veins and arteries. So that's how you can help avoid it. But then to avoid the neck and shoulder aches and pains or cramps, what you can do is any sort of exercise in your seat. Movement is crucial. You are getting your blood flowing, your muscles activating, so even things like squeezing your butt, see how I'm going up like this? You're on stretch right now. So that gets your muscles pumping, it gets your blood flowing. You can straighten your knee, you can lift your ankles, you can do upper body stretches, anything.
Neck rolls.
Yes, and then get up out of your seat, right? Take breaks.
Okay.
Don't, you know, you're going to disturb your plane neighbors, but it's better for your body to be
You'll be like
moving.
stretching in front of
the
them.
aisle,
You're one of those people.
Like
that lady with her leg all up.
It's kind of being smart, though. Smart about your body.
Really quickly on that note, is there a seat position that's worse for your body on the plane? Like
seat position?
Is there a seat that's worse? Middle, aisle, window?
I think the middle seat would actually be the best because you can't lean on one side or the other. I'm a window person and I like to lean. So then I am crooked and I get off feeling stiff and achy and I have to stretch the other way. So sitting with neutral posture is actually the best with a good upright posture.
Okay, a lot of people hitting the roads in the car this weekend. What about those long road trips? We know if you're a passenger princess, like myself,
diva,
you can stretch and do all that, but what if you're driving?
So if you're driving, what you can do is on a very safe open road, you can actually hit cruise control and just do a little muscle activation in the calves by moving your ankles and your feet. Okay. Also just sitting upright. So if you just sit upright and then pull your core in, you feel how your muscles are working?
Yes.
These are your postural muscles because you've been sitting back, driving. So actually just sitting up and then just safely, again, very safely, you can move your heels up like this, and that actually gets the blood pumping. But stopping, obviously, is the best. I always recommend once an hour. Usually it's 2 to 3 hours or every 100 miles.
Okay.
All right. Some very good advice as we
get those glutes going.
As we hit the roads. Exactly. Dr. Karena.
I had leg day today, so this is like extra.
Thank you.
She's still working out.
I know, she's still working out. Gee, what did you lift today?